Here's plug, Burnt Out to Refreshed by Cassidy, Natalie, and Elaine. Burnt out is characterized by emotional exhaustion and can result in depersonalization and decreased personal accomplishment at work. The emotionally exhausted clinician is overwhelmed by work to the point of feeling fatigued, unable to face the demands of the job, and unable to engage with others. Nurse burnout has been an issue for years. With the outbreak of COVID-19, the situation has gotten worse. There are many factors that contribute to nurses' overall burnout. The number one cause of burnout is healthcare staffing shortages. Other major causes include emotional exhaustion, demanding workloads, workplace culture, and lack of respect, among others. Statistics in recent years indicate that the profession may be reaching a crisis point. Burnout creates a variety of problems, and the stress, fatigue, and compliancy that results from burnout can put patients at great risk and reduce satisfaction with healthcare experience. In addition, high nurse burnout rates can translate into high turnaround costs and significant financial losses to primary care facilities. Think of it this way. The average cost to refill a nurse position is $46,000, and the financial loss to primary care can be huge. Healthcare providers sign up for a unique job caring for people. Their work requires them to take on a variety of tasks, and providers may experience a range of positive and negative experiences during one shift. Our design not only offers the staff a way to build up, but a way to build on their wellness. Our group focused on redesigning health clinics to infill unimportant bound spaces with sensory features that support the well-being of healthcare providers. Whether through a wellness lounge, kiosk, corridor, pause point, nook, or office, redesigning clinics in this way will not only recharge and support the staff, but it will also utilize found and unused spaces, making transitions cheaper and more obtainable for each individual clinic. Through product and interior design, staff well-being can be improved. Clinics can enhance connecting spaces with pause points and wellness nooks, or by rethinking staff areas and unused spaces to include nooks or sensory features. Imaged by David Petrino, during the pandemic, he converted his rehabilitation lab into recharge rooms for frontline healthcare staff. He used the latest research on the human's connection to nature and how it can reduce stress through multisensory design experiences. A similar approach can be implemented in primary care, using online images taken at Michigan Medicine's podiatry clinic in Ann Arbor. We showed different design approaches that this clinic could take for each space. Maybe we could remove a wall within the long corridor to bring extra natural lighting and refreshing atmosphere for moving staff. Rethink working spaces to restore health while work is being done. Clinics try to save money anywhere they can. Using the floor plans of Ypsilanti Health Center, we found all existing staff areas that could incorporate new design features for positively distracting their staff. It should be well known that providers spend a lot of time in corridors walking from room to room. Pause points or our nook, for example, could be positioned within the corridors of a clinic and preferably punching into unused areas. New to light design additions can be costly, but just strategically finding these areas within an existing clinic can reduce initial costs. The nook gives autonomy to providers at work. Maybe they don't have their own desk, but they can have a space to make a call, do a quick chart, or quickly calm their mind and reduce the load on their feet. Through sensory design decisions, the goal is to reduce stress and increase satisfaction in production, focusing on the 5 different senses and getting guided and experienced eco-friendly designers to help. In addition, we can reduce workloads by linking mobile health apps and medical dictionaries to the kiosk for the user. The mobile health app offers many platforms for monitoring and managing mental health. These apps vary in function but promote engagement with therapy homework such as color matching, symptom assessments, monitoring moods, and practicing coping skills. On top of monitoring mental health, more accessible and pleased kiosks can help reduce the stigma and discomfort around discussing mental health. App examples include Medical Dictionary, I Love You, Flowy, More Energy, and Mood Tracker. Hopefully, the kiosk will assist healthcare providers in reducing stress and workload. The economic impacts show how hospitals that adopted burnout reduction strategies for nurses spent about 1/3 less annually on burnout-induced turnover costs. Since our interventions are small, they can be adopted to retrofit existing care facilities and avoid excessive renovation costs. Socially, studies have proven that stress relief, relaxation, and exercise can be effective in alleviating burnout among healthcare professionals, thereby improving patient satisfaction and quality care. Also, some hospitals have implemented restorative breaks that are similar to our design. These rooms are proven to be effective on reducing stress and fatigue. Short breaks in medical work can be effective in improving indicators of fatigue, burnout, depression, and wear out, and thus improving the healthcare provider's efficiency and performance.